What is a thoracic duct? What is thoracic duct in lymphatic system? The thoracic duct is the largest lymphatic vessel, acting as the main drainage pipe for lymph, fluid, fats and waste from most of the body, legs, abdomen and left upper body, back into the bloodstream. It extends from the upper part of abdomen to the lower part of the neck. It is 45 centimeters in length and 5 millimeters in diameter. It has a beaded appearance due to presence of multiple valves. What is the route of thoracic duct? The thoracic duct has the following route. Its origin in abdomen. It begins in the upper abdomen, from the cisterna chyli, near vertebrae T12 to L2. Its route in thorax, in posterior mediastinum. Thoracic duct enters the thorax via the aortic hiatus. Then it ascends to the right of the vertebral column, between the aorta and azygos vein. Midline crossing. Around the fifth thoracic vertebra, T5, it crosses from right to left, then entering the superior mediastinum. Its route in superior mediastinum. It ascends behind the esophagus, aortic arch, and left subclavian artery, to the left of the vertebral column. Then its route in the neck, specifically the root of neck. At the C7 level, it arches laterally, above the clavicle, passing behind the left common carotid artery, vagus nerve, and internal jugular vein. Termination of thoracic duct. Thoracic duct eventually drains into the venous system, at the junction of the left internal jugular and left subclavian veins. What part of body does thoracic duct covers? The thoracic duct drains lymph from the entire body below the diaphragm and the left side of the body above the diaphragm. It is the largest lymphatic vessel in the body and carries most of the body's lymph and chyle back to the bloodstream. The specific regions that the thoracic duct covers include both lower limbs, legs, the entire abdomen and pelvis, the left side of the chest, hemithorax, including the left lung and the left side of the heart, the left upper limb, arm, and the left side of the head and neck. There are some important anatomical relations of thoracic duct. Mnemonics for the thoracic duct focus on its key relations. Duct between two gooses. Duct between azygos and esophagus. It is a common mnemonic used in human anatomy to remember the structures adjacent to the thoracic duct in the posterior mediastinum. The mnemonic uses the following associations. Thoracic duct. The duct refers to the thoracic duct itself. Two goose refers to two structures that sound like goose. The azygos vein and the esophagus. In this part of the thorax, the thoracic duct is situated between the azygos vein to its right and the esophagus to its left, in the posterior mediastinum, anterior to the vertebral column. This mnemonic helps students recall the key anatomical relationships of the thoracic duct as it ascends through the chest cavity.